and provide new ways to meet the educational needs of students in child care settings. As you know, Missouri has now received shipments of both the Pfizer and Moderna vaccines, and we have been successfully administering vaccines for more than 2 weeks. On Monday, we received more good news that CVS and Walgreens began vaccinating residents and staff in Missouri's long-term care facilities through the Federal Pharmacy Partnership. Based on the information we have available, more than 66,000 frontline health workers and long-term care facility residents and staff in Missouri have received an initial dose of the COVID-19 vaccine as of yesterday. Vaccinating facilities across the state will receive nearly 84,000 initial vaccine doses this week, and we expect to receive more than 73,000 additional doses next week. Next week, we also will be receiving shipments of the second dose of the Pfizer vaccine for those who received their first dose earlier this month. It is extremely important that every Missourian return for the second dose of the vaccine. I also want to remind the public that the vaccine shipments of the second dose have already been accounted for and are not included in the reported weekly allotment counts. Our vaccination plan is going well. We are continuing to work through Phase 1A, and additional details on Phase 1B will be forthcoming. With new information and vaccine developments occurring all the time, we are constantly updating distribution and administration details. Again, I want to highly recommend and encourage all Missourians to visit our vaccine website, mostopscovid.com. Again, that is mostopscovid.com. The site is updated daily and is one of the best resources available to find information and answers to common questions. A vaccine hotline is also currently in the works to help answer questions for Missourians, which we hope to have up and running soon. I want to thank our state, local, and private partners for their continued efforts and coordination throughout this process. I also want to give a very special thanks to the Missouri National Guard members who have stepped up to assist with the vaccinator applications, address redistribution logistics, and help communicate our vaccination plan. As far as our healthcare system capacity, our partnership with Vizient continues to provide relief for these same 6 participating hospitals. I also will note that those original 6 have continued to ask for support for that purpose. We now have 196 contracted staff, including 33 respiratory therapists, 75 certified nurses aides, and 88 nurses with various specialties. On Monday, 24 of these healthcare workers reported to work as assigned to hospitals. The remaining staff will begin work throughout the coming days and into the new year. We are very encouraged by the progress Missouri is making and remain optimistic for the coming weeks and months. Although we are still experiencing high volumes of cases, our data shows that Missouri's cases and hospitalizations are stabilizing. With that said, this fight is not over, and prevention remains one of the best weapons we have against COVID-19. We must continue the social distancing. We must wear a mask, minimize travel, and avoid large gatherings. It is these actions combined with the vaccine that will get us through this. We know back before Thanksgiving when we made a plea to the general public in the state of Missouri to ask them to focus on these three things. On one another's health, it worked. And we need to maintain those three things. So much has been politicized about one thing, but it's all the three things that made the difference, and Missourians took it upon themselves to do it, and the results have put us in a much better place than most states around us, and actually in the top 10 of the United States for how we're handling this at this time. With that, I'd just like to say God bless to everybody. I wish everybody a happy new year, and thanks again for being on today. Dr. Williams?
Thank you, Governor, and I just want to echo the Governor's comments. When I got up this morning, I just want to thank the citizens of Missouri. We are 9th in the country for cases per 100,000 over the last 7 days, and that is just a testament that people have listened, have followed our guidance, and just incredibly thankful for that. Our hospitalizations are increased, but they are stable. When we look at our R0, when we look at our cases per 100,000, as I mentioned, better than any state around us but one. We're just incredibly thankful because that's just citizens doing what we would hope they would do. But to the Governor's point, I started my morning this with a patient who called me. Her whole family is very sick. They sounded pretty bad on the phone, so do not want to drop our guard by any stretch of the imagination. Also, as we reflect on the past year, I want to thank you. There have been some great stories in the dailies and on the radio and the news about the rollout on Monday. I can't tell you how much I appreciated your coverage of that, of vaccinating the long-term care facilities, and just some really good reporting and some really good stories. So thank you for that. Just want to address three things real quickly that I think have been on your mind that you've been asking me about. The first one is the UK variant. It's not a different strain, it's a variant that was discovered in Colorado. Our lab has the capacity to detect that, and we're building that out. You might ask, well, how do you know someone has that? And when they do the assay using the PCR, there is a signal that's seen. There's basically an amino acid. Asparagine is replaced by tyrosine, and they're able to pick up on that in the variant. And so we will have that capacity, if we see that in the lab, to seek that out. I know you've been asking about that. The other thing a lot of people ask me about our vaccination plan, and I can't thank the Governor enough. He's given us every resource at the state's disposal to roll that out, including Robert Nodell, his Deputy Chief of Staff, who's leading up our efforts, who's phenomenal. So we greatly appreciate him making available to us anything and everything we need. And that's paying off. We've had 314,000 vaccines shipped to us already in the month of December. Now people say, well, wait a minute, there's a discrepancy between how many you've had shipped to you and how many you've actually vaccinated. But you've got to remember, like the rest of the country, 50% of our vaccines have gone to the long-term care facilities in our partnership with Walgreens and CVS, and they just started on Monday. So there's going to be a little bit of lag there, but we think, I just got off the phone with Nikki Strong, the executive director for the Long-Term Care Facility Association. We think we'll have, by middle January, all those vaccines, the initial vaccines, should be administered or shortly thereafter. And so we're just incredibly thankful for that. And if you've seen the pictures, and some of you have done the reporting, I've watched you, it's just a joyous occasion to be able to deliver the vaccines to those people who are most vulnerable. So with that, Kelly, I'll answer any questions.
First and foremost, the Governor mentioned 66,000 people, frontline healthcare workers, long-term care residents have been vaccinated so far. I think it just needs a little bit of context. Is that on par with the plan as of right now? Is that above, below? How does that look as of right now?
Yeah, I think the only thing that's different is that Walgreens and CVS just started vaccinating on Monday. So I think you're going to see a lag time between that 314,000 number I gave you and actually vaccinations in people. But I talked to Nikki today, and Walgreens and CVS are robustly out there. I looked at some data today, and we have 1,021 zip codes in Missouri, and almost everybody in a zip code almost every zip code has had somebody vaccinated in it, if I said that correctly. And so that means a tremendous amount to us, that geographically the vaccine is getting out there to people throughout Missouri. And that's just going to become more and more robust as more vaccine is delivered. So I hope I've answered your question, but the little bit of discrepancy is because of the 28th start for half the vaccine we've received. If you look at the half that we control going out to hospitals, all 25 of our 25 largest healthcare systems, hospitals, have signed up and are receiving vaccine. And of the top 50, I think it's 44. And the 6 that haven't, there's some quirks to that we're working out. So we're incredibly appreciative to our hospital partners. They've done a great job. Now, to be realistic, as we move into the rest of Phase 1A, not the long-term care facility, not the hospital-based healthcare workers, but those that aren't, it just logistically becomes harder. And we know that, and we've accounted for that, and we'll be doing that in the next 2 weeks. So the numbers may not go as quickly just because it's a lot easier to vaccinate everybody in one hospital than it is 10 primary care doctors in one community.
Another question on the UK variant. Is this something that would be covered already by the current Moderna and Pfizer vaccines, or we need more testing for this, or how does that look?
We don't have any evidence that it isn't at this point, but that those studies are ongoing. At this point, the UK variant just appears to be more infectious. It does not cause more severe morbidity or mortality. It just appears to be more infectious. And they're looking at whether or not the vaccine would cover it. Intuitively, we think it would, but we've got to prove that. You're welcome. Thank you, Kelly.
I thought this was going to be an easy day there for a second.
Governor, good afternoon.
Brian?
Good to see you. You released a statement to us today, to MissouriNet, your office did, and said that changes are needed basically in the veterans' homes, talking about the COVID deaths.
Right.
And I know I've asked you about this multiple times. What kind of changes are you thinking, and does that include leadership changes? Can you share any details about what you're thinking about?
You know, I got to be careful with that, what I'm saying. Here's what I'm saying. I think hopefully everybody knows, long before I was ever a statewide elected official, how much I've supported the veterans in this state. And frankly, it's not about the commissioners, it's not about the chairman, it's about the veterans that are in those homes that I care about. And I'm going to do everything within my powers to make sure they're taken care of. And if people didn't do their job, is why I called for an investigation to expose that, if that is the case. And I will continue to do that from this position, whether it's a lieutenant governor, whether it's a rep or a senator. But the veterans will be a priority. I'm not going to worry about everybody's personal lives that sit on a commission or chairman. I'm just going to absolutely worry about the veterans, and that's my whole focus.
There are prosecutors in the state who are unsure come Friday whether 17-year-olds should be treated as adults or as minors. It depends on how you interpret a new law, but what's your understanding of whether there's been funding put forward to that expansion effort?
Well, you're talking about the change in the law where we're trying to treat juveniles, and we're moving juveniles up to the 18 from 17. Is that kind of what you're asking on that? You know, when I was in law enforcement for 22 years, once you become 17, you become an adult. There is factors that becomes a problem, because a lot of kids sometimes can be in school and they're not out in that adult arena, I guess, one time. So changing it to 18 is one thing, but I think you also have to realize when you move that age up, that puts a lot more stress on some other agencies that may do that. But I think they're trying to work through that process to figure out how we're going to handle that. But the realistic is the law changed, and that's where it's going to go.
I know some hospital centers, as the Pfizer vaccine was rolled out a couple weeks ago, received less vaccines than they were initially anticipating. Are we caught back up with that? Are those hospitals getting what they need now? How does that process sort of look like right now?
Yeah, well, look, here, I think the most important thing is every vaccine that we're coming in, every shipment we're coming in, we're shipping it out the doors, we're getting it out there as quick as we can. I think trying to get caught up in the numbers, whether it's 400,000 or 375,000, we're looking for things just to find something wrong, when I think the main thing is whatever we get, we get. and we want to get it out the door as soon as we can. So it all depends on how they signed up, who was there, can they distribute 1,000 doses? There's a lot of things go into that factor. But I'm telling you right now, and I'll give Dr. Williams and his team credit on the fusion cell, there is a plan in place. So if you want the vaccination and you can handle the containments of it and you can handle the amount of doses, we want you to have it because we want it in people's arms. That's where we want it. So we're doing everything we can. So again, I think as those vaccines come in, one of our priorities is make sure somebody's utilizing just as quick as we can. So those numbers are going to continue to go up. And I'm just thankful the things are going well in our state versus some of the other states that's trying to deal with this. All right, thanks everybody for being here. Thank you.